Maternal health sector is one of the sectors that is being developed by the country Kenya so that it may reach the developed countries like the USA. Although the development is still in progress, many challenges are being faced by the Kenyan women and the doctors too.
Hi viewers, my name is Dr. Wambile. I'm the medical officer in Equity Afya Bungoma branch. And the topic of maternal health is a very vital topic in the development of any health sector. About the challenges faced by women, there are quite a number, especially for women who come from marginalized areas and from the rural areas. And among the challenges we face, one of it being accessibility. You realize that in rural areas, there's a problem with accessibility to health facilities. If we compare the surveys done in Kenya, the latest being 2022, there's a lower number of health visits by pregnant women in the rural areas as compared to urban areas. So there's an issue of accessibility, this being the road system, the referral systems, and even awareness in the rural communities. The other challenge we face is maternal education and ignorance from some of our clients. They are not aware of when to seek health services and when to seek them. From the survey done by the health sector, the Ministry of Health in 2022, it showed that most women in rural facilities are not aware that they need health services when they are pregnant. The other challenge we face is a lack of equipment and commodities, especially in the rural facilities. Sometimes the human resource is available, but you realize that there are no equipments or commodities to help our mothers.
Okay, and you see now Kenya is trying to develop the maternal sector so that it may reach the developed countries. Is the development okay with you, or Kenya should just continue with the current situation?
I would say for the past 5 years, and especially from the previous administration, there's been a lot of development in the maternal health sector, especially spearheaded by the First Lady, Excellency Margaret Kenyatta. So there have been development in the past few years, and it's a very good development. We are trying to match the developed nations in terms of improving maternal outcomes, reducing the mortalities, and even trying to minimize some of the health conditions in maternity. So it's a good idea to develop and to continue developing until we reach the international.
Despite the challenges being faced on the new development, the doctors and nurses are in correspondence with the development because of the impacts being made, which are...
In the current situation in Kenya, there are many young mothers who give birth to premature babies. Is there any development made so that the premature babies may come out alive?
Okay, in terms of infant care, I'd say we have made development, and at the same time, we are not doing very well. The developments mostly are for the antenatal care, where we take care of the mothers before delivery. The outreach is good and accessibility is improving, but the care of children, both especially born prematurely, is not yet up to par. You realize that most of the facilities don't have care for the infant, what we call NICU, the neonatal ICU, and you realize most of the children who are born prematurely don't make it. If they make it to the facilities with the NICUs, most of the time they are crowded, and sometimes you find they are understaffed, leading to the children not getting the care they deserve. So in that sector of infant care, I'd say we are not yet up to standard, but in the sector of vaccinations and immunizations for the children, there's a lot of development that has been made.
Despite the government wanting to develop the maternal health sector, most women are not ready because the sector only favors the high-class people and left the only low class in trouble, making them going back to the maternal health, which was in the previous years. Reporting for News Outlook Tandao TV, my name is Vivian Nakwaka.